Meet Maggie. Maggie is training for a marathon, but unfortunately she's experiencing chronic stable angina. Luckily for Maggie, Dr. Christina witnessed her struggling and suggested that she come and see her at her office.
So due to your chronic stable angina, you are going to be prescribed nitroglycerin.
Other uses for nitroglycerin are prophylaxis of angina pain, congestive heart failure, acute MI, controlled hypotension for surgical procedure, and anal fissures. Some unlabeled uses include pulmonary hypertension, hemorrhoids, and retained placenta. This drug is perfect for Maggie because it is a vasodilator, so it opens the blood vessels in order to improve blood flow and therefore reduce how hard the heart has to work. This drug will also relieve the symptoms Maggie is experiencing, such as shortness of breath, sweating, and discomfort such as tightness, squeezing, crushing, and burning sensations.
What is the mechanism of action of nitroglycerin? It decreases the preload and afterload, which are responsible for decreasing left ventricular end-systolic pressure, systematic vesicular resistance. It dilates coronary arteries, improves blood flow through the coronary vasculature, dilates arterial and venous beds systematically. What are the side effects?
Some side effects include dizziness, collapsing, nausea and vomiting, and some more include headaches, flushing, postural hypotension, tachycardia, syncope, pallor, sweating, and even a rash.
Are there any contraindications or precautions for this drug? Yes. Their hypersensitivity to nitroglycerin or any nitrates includes severe anemia, increased intracranial pressure, cerebral hemorrhage, closed-angle glaucoma, cardiac tamponade, cardiomyopathy, and constrictive pericarditis. So, precautions include nitroglycerin is a pregnancy seed drug, breastfeeding, children with postural hypotension, severe renal hepatic disease, acute MI, abrupt discontinuation, and hyperthyroidism.
Dr. Christina takes time to explain the pharmacotherapeutics and pharmacokinetics to ensure Maggie knows everything she needs to know before taking this drug. Nitroglycerin comes in many forms. The first kind is sublingual tablets. This is used for treatment and prophylaxis of acute angina pectoris. When pain occurs, use one tab every 5 minutes until relief occurs. Use one tab prophylactically 5 to 10 minutes before activities. You have to keep in mind the onset is 20 to 45 minutes and the duration is 3 to 8 hours. It also comes in an aerosol form. This is for treatment of acute angina pectoris. It's sprayed under the tongue, not inhaled, and you must prime it before your first time use. The onset is 2 minutes and the duration is 30 to 60 minutes. Next is a transdermal patch. You apply a patch daily to a site free of hair. You must remove patch at bedtime, provide 10 to 12 hour nitrate-free interval to avoid tolerance. The onset is 30 minutes to 1 hour, and the duration is 12 to 24 hours. Another form is topical ointment. It's for management of chronic stable angina and should be measured on the papers given. Use the paper to spread on non-hairy area of chest, abdomen, or thigh. Use a thin layer spread over 2 to 3 inches, but do not rub. The onset is 30 to 60 minutes, and the duration is 2 to 12 hours. Sustained release capsules are also for management of chronic angina, used every 6 to 12 hours on an empty stomach with water, 1 hour before or 2 hours after meals. Do not break or crush these. The onset is 20 to 45 minutes, and the duration is 3 to 8 hours. Intravenous is also for management of chronic stable angina, the first 24 to 48 hours after a heart attack or other cardiac event to relieve angina, hypertension, and pulmonary edema. The onset is 1 to 2 minutes, the peak is immediate, and the duration is 3 to 5 minutes. Possible interactions include beta blockers, diuretics, antihypertensives, calcium channel blockers will all increase the effects. Mixing sildenafil, tadalafil, and vardenafil will cause fatal hypotension, and the use of aspirin will cause nitrate levels to increase. Nitroglycerin is safe for all elders to use, unless they are known to have renal issues or poor hepatic functions. Luckily, Dr. Christina's advice worked. Maggie's feeling better than ever for her upcoming marathon.